Yeah, I think the forum is a somewhat unique opportunity because you're in a remote area, you meet a lot of different people with different backgrounds, and when you want to have disruption, you need to get out from your usual day-to-day life, and you need to meet people you usually don't meet. And so I think this place here is somewhat the ideal place to have this kind of disruption and distraction. I don't think it's an initiative at the moment. The point is that this idea of a European cancer plan is floating around in the European Parliament, at the European Commission, also some patient advocacy groups and also industry. And so it's a slow process, and I think there is a sense of we need to do something also at the European level. Nearly all countries have cancer plans in place, but what is missing is sometimes implementation. You have health inequalities, and these are topics which cannot be addressed by individual countries. I think here you need to have some European Union action. I come from the research-based industry, and I think we are only one element in the cancer care pathway, so when it comes to treatment. Nevertheless, I think one of the big challenges is that not all European citizens have equal access in terms of innovation, but also equal access to healthcare or cancer care in general. And you see this not just in time to access, but also in outcomes. So 5 years survival, you have great variations from country to country. And here is a potential for European action to improve the situation. I completely agree, and I think therefore such a cancer plan I think involves multiple stakeholders. 40% of the cancers are preventable, and countries usually invest 2 to 3% in prevention. So there's a huge gap, and if you can prevent cancer, this is much more or much less expensive than treating cancer. So and I think also in terms of outcomes, each cancer prevented means that you have a life in full quality. I think the European Union has some financial tools where they can support countries on the one hand, and I think also in terms of access to innovation without patients having innovation available is no innovation. So that means also we as an industry have quite some interest to find collaborative solutions which reflects also the affordability levels which are different in that region compared to other countries, but also ensure fast access. I think on our end certainly collaboration, dialogue is important, and also to explore new ways of financing and access schemes. So when it comes to the research-based industry, we are one element in the whole cancer patient pathway. But what you see with scientific developments, you can test early on whether someone is more likely to get cancer or not. So these, let's say, the lines between treatment or prevention are somewhat disappearing, and that's also where we, as a research-based industry, come in. So advances in public health genomics, more precise tools to stratify patients and to make sure that the right patients get the right treatment. I think this is certainly the future. Many of the new cancer medicines, for example, have a test in place where you select patients and where you can find out which patients respond best.